The CDC has now endorsed booster shots for all three of the vaccines available in the U.S. The agency has also approved a mix and match approach. So here to talk more about the vaccine is medical editor Dr. Dave Hnida. And Dr. Dave, who needs which booster and when should they be getting it?
It's actually pretty straightforward when you take a look at things. If you've had the Pfizer or Moderna vaccine and you are over the age of 65, if you have any underlying health conditions, for example, you have diabetes, you have high blood pressure, you are overweight, let's say you live with or visit frequently someone who is older and in poor health, or if you work in a job that puts you at a little bit higher risk because of public contact, you certainly can go get your booster right away. And that booster can be a Pfizer or Moderna, doesn't matter which one. And for others, if you're kind of on the fence about this one, it really is a matter of 6 months after your second vaccine, you would go ahead and get your booster shot at this point in time. Now, let's say you got the J&J. What's the story with that? Well, that one is straightforward as well. It is 2 months after you had your J&J vaccine, you can go ahead and get vaccinated. And I think a lot of us are thinking that it doesn't matter what your personal circumstances are in terms of risk, exposure, so on and so forth. Everyone needs to get a booster if they had the J&J vaccine. And that booster, once again, 2 months after you got the original vaccination, and it should be most likely a Pfizer or a Moderna. One quick point too, when you go get your vaccine, please get your flu shot as well. It is okay to get the flu shot as well as your COVID booster at the same time. So we really are working hard to try to protect all of us against everything that's circulating out there right now.
Yeah, that's some great information. I know a lot of people have wondered about that. I know, too, we're still waiting for regulators to approve the vaccine in 5 to 11-year-olds. When that happens, how will the vaccine rollout be different than it was for adults?
Well, you hope it's going to be a lot less chaotic than it was with what we went through last winter and spring. I think it will be much more organized. And the one thing we're not going to see is these giant massive vaccination sites, which really were a little bit tough when they first rolled out. I think we're going to see things on a much smaller, much more personalized level, which is really what you want to see, particularly when it comes to children. We're going to see vaccinations being given in pediatricians' office, primary care doctors' offices, at pharmacies, school clinics, and so forth. And so it will be a much more personalized approach where I think parents are going to have the opportunity, much more than we did, to ask questions about the vaccines and be reassured that the vaccines truly are safe and they truly are effective, which they are. And I think it's important to understand that the kids do need to be vaccinated. I know that a lot of folks say, well, COVID really isn't that big a deal in young children, but yet some kids do wind up having issues with severe COVID. They can be hospitalized. They can also suffer from long haul COVID, and that's a big problem in kids. We worry about the classroom. The more kids we get vaccinated, the less we got to be arguing about things like masks and so forth. We think about the community, and I think getting kids on board and being vaccinated will help protect our community at large. So I think that the rollout will be a lot different than what we've seen. It'll be organized, much more easier, and I think it's really going to be a good opportunity for people to ask questions if they have concerns.
Great. We've had some practice with it, so hopefully this is a bit smoother. Merck is seeking emergency authorization for its pill to treat COVID. Any concerns that this may discourage vaccinations?
Boy, that's a good point, because I think a lot of people are saying, well, there's this magic pill coming out and I don't need to be vaccinated now. If I wind up getting sick, like if I get strep throat, they can just give me penicillin and I'm going to get better. It doesn't work that way with this particular product. This is a series of pills that is being manufactured by Merck. It is expected to be available sometime after the first of the year, most likely. And it is something that is taken for 5 days, costs about $700 for a full course of dosing. But the thing to remember is that it really is intended for people with very mild symptoms of COVID. And the goal is to prevent them from becoming sicker to the point where they wind up in the hospital or even die from getting COVID. And even in that particular situation, I think people need to understand something that's very, very important here. And that is, in the studies with this new medication, the pill really was only about 50% effective in preventing mild disease from going on to becoming more severe disease. Now, you might say 50%, it cuts it in half. That's great. Well, that is good, and it's going to be helpful. But I also keep in mind the fact that vaccines, we know, can lessen your chances of getting severely ill by more than 90%. So in this particular situation, the vaccine definitely much better than just simply waiting and taking a pill in case you get sick. We always advocate, please do prevention. It is much better than having to cure.
Right, a lot of good information in that too. While the majority of hospitalizations are in the unvaccinated, we're still seeing some of those breakthrough cases. Why are some of those cases people ending up in the ICU?
I think when you look at breakthrough cases, most people are not getting severely ill, but the ones that do wind up becoming very sick or do wind up dying, there's a lot of attention being paid to it. And a lot of people say, well, gosh, the vaccine just isn't doing the job. But it really is doing the job. We just had recently a high-profile situation with Colin Powell. Colin Powell had really what we call a situation where he was medically frail. He was 84 years old, so he was old, and that combined with underlying medical conditions. He had blood cancer, something called multiple myeloma. He had other health issues going on, and so really where we're seeing severe breakthrough infections are in the elderly as well as those who have underlying medical conditions. Take a look at what's going on in Colorado. In Colorado, we've had probably about 8,000 deaths from COVID. And when you take a look at that number, you have to also take a look at the number of breakthrough deaths from COVID. It is 50. And so we have actually had quite a bit of protection for people who are vaccinated. And it really does show that the vaccine is very effective in preventing people from wind up being in the hospital or once again wind up dying from COVID. So please get your vaccination. Still vitally important. And not just your booster. If you've not been vaccinated, even with your first one, now's the time to get it.
Great. Well, thank you so much, Dr. Dave, for answering all these important questions. There's always new developments and new questions that come up, so we appreciate it. And to see all of Dr. Dave's segments on coronavirus, you can head over to cbsdenver.com.